Good afternoon, everybody, and welcome to our mastermind session today. Today, we're talking about new MBS items to support allied health participation in multidisciplinary case conferences. My name's Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd just like to acknowledge the traditional custodians of the land that we're meeting on today and pay respect to elders past, present and emerging. We have three presenters for you today. Donna Block, who's a Primary Care Improvement Officer, Heidi Avery, who's a Primary Care Improvement Officer, and Joanna Coots, who's an Integration Care Manager. There will be a survey at the end, so we would love you to fill it in. It will only take 30 seconds, and you will get a certificate in your follow-up email tomorrow. This webinar is being recorded and will be able to be accessed on our PHN website in our education library. All right, I'll hand over to you, Jo.
Thank you, Jenny. I too would like to acknowledge the traditional owners of the lands for which we meet today and extend that respect to any Aboriginal people that may be here with us today or watching at a later time online. Sorry, just move to the next slide. So today we're just going to run through what the intent of the new item numbers are. We'll provide an overview and then we'll walk through some considerations and an example related to the chronic disease new item numbers, and then we'll have time for discussion and questions. But basically the new items will allow allied health practitioners to receive a payment for participation in case conferences, patient usual GP and other health providers. So why are the changes being made? Largely this is because of the recommendations that have come out of the MBS review that was completed at the end of last year. They are, for the first three item numbers, to promote greater uptake of GP-led case conferences for people with chronic diseases. And secondly, the other three item numbers are to promote the joint planning for children with autism or pervasive development disorders under the care of a paediatrician or a psychiatrist. I'm going to hand over to Heidi now. So Heidi, when you're ready.
Yep, thanks, Jo. From the 1st of November, new Medicare benefit schedule item numbers were made available to eligible allied health practitioners participating in the multidisciplinary case conference with medical practitioners. They are intended for the chronic disease management under the care of the general practitioner in either community or residential aged care settings, and the early diagnosis and treatment for children under 13 years with or suspected of having a pervasive developmental disorder. So that's including autism or an eligible disability under the care of the specialist or the consultant physician or GP. So the new items are all time-tiered items. So the range is 15 to 20 minutes, 20 to 40 minutes, and over 40 minutes. Okay, so on this one, you will find a list of the allied health professionals that can be considered as part of your team care arrangement and potentially be invited to attend a case conference. So as per the existing arrangements for case conferencing, other providers can continue to participate in a case conference and use their existing item numbers for billing. However, these new item numbers are only for allied health professionals to bill and must be in line with the existing arrangements for the reviews of the team care arrangement. So as I said, there are three MBS items for participation by eligible allied health practitioners in a multidisciplinary case conference for patients with chronic disease. So the three new items are 10955, 10957 and 10959, and they are all time-based consults. So case conferencing items for chronic disease management can be accessed no more than once every 3 months. So in line with existing arrangements for the review of a team care arrangement. So all these descriptors are straight from the MBS, and I would encourage you to review prior to adding allied health to your case conferencing model. So the next ones, these next three are items for participation by eligible allied health practitioners in a multidisciplinary case conferencing for children under 13 diagnosed with or suspected of having a pervasive developmental disorder, including autism or an eligible disability. So the three new items are the 82001, 82002 and 82003, and these are for time-based consultations as well. So with these ones, there are no frequency restrictions for case conferencing items for autism or pervasive developmental disorder and disability. So what does this mean for providers? Well, it means that allied health professionals will now get remunerated for their participation in a case conference, where before there was no MBS item numbers listed for allied health. So the case conference must be organised by the medical practitioner and involve at least 2 other persons providing a different type of care to the patient, in addition to the patient or family members or carers. And the allied health practitioner can be counted as one of these other 2 persons, and the eligible allied health practitioner does not need all participants to be MBS eligible to be able to claim payment for their participation either. So as case conferences can be used to determine what type of care may be needed going forward, the new items do not require allied health practitioners to have a pre-existing relationship with the patient. So I'll just say that again, allied health don't need a pre-existing relationship where GPs will. So a referral is not required for eligible allied health to access the new items. However, the patient must agree to the allied health practitioner participating in the case conference. The patient may agree, though, through discussion with their medical practitioner, and the allied health practitioner should ensure that the patient has agreed and that their agreement has been recorded appropriately. So I'll now hand over to Donna, who will give you some tips on things to consider. Thanks, Donna.
Thanks, Heidi. As you may already know, Health Direct is the platform that is funded by the government for all health providers and supported by the PHN. Health Direct has an online virtual waiting room, which is useful for multiple participants on the one call. The PHN, in partnership with Forsyths, have a dedicated help desk to support practices with telehealth consultations. They are trained in the Health Direct platform, but will help with other platforms as best as possible. They're not the experts in those platforms. The details for the help desk are on your screen, or should you wish to register for Health Direct, just head to our website. So considerations, or the how, if you like. Establish which of your colleagues are interested in working with this model and develop a process for the practice that will allow you to coordinate multiple case conferences as a session in the appointment book, ideally with the same 3 health professionals. You could do these in 1 to 2 hour format on a bi-weekly or a monthly basis to start with, and do more frequently if it is something that the clinicians value. Consider whether you will be face-to-face or using telehealth conferencing, or a version of both. You may decide to have the patient involved from home. The specialist could also be on screen, but you may have allied health professionals that work in the practice or are happy to be there face-to-face. So these could be together. These are all the decisions that will need to be made in the planning so that things are managed well and run smoothly. Once you have decided that you'll use this format, then it's about which patients are going to benefit. This will obviously be driven by your GPs as to which patients they have concerns about and who they would like to have the opportunity to discuss with other health professionals. GPs will need to gain the patient's consent to a case conference and also to allied health participation in that same conference and to document the same. Allied health need to know that consent is given before they can attend the case conference. Therefore, they will need to cite the documentation and keep a record. And finally, establish if there is a need for further follow-up to be arranged by the case conferencing. Example, the next TCA is due for a review. So item numbers and timing. The table on the screen outlines the different item numbers for GPs and allied health. Ensure you record the contribution from other health professionals involved in the case conferencing, and consider that the timeframes for billing are consistent for all health professionals for compliance. Red flags would be raised if two providers billed for a 20-minute conference and the third billed for a 40, as an example. Agreement and consistency is key for compliance. We know that providers don't necessarily like to close down their consult notes immediately, but for compliance, recording that start and end time are crucial when doing multiple case conferencing. Remember, if it's not recorded, it didn't happen. Now, this is a very simplified example of a session in practice. In this example, we've had allied health employed in the practice, so very easy to coordinate the case conferencing. This is a 2-hour session with all the same providers. I've chosen an afternoon session straight after lunch on a Thursday, but obviously you work with what suits your providers. Start with one session and see how you go. Ensure protected time is allocated and appointments run to time. I've used a mix of billings and times that would happen in real life. And you may note that the item numbers are part of the appointment to assist GPs and allied health with time-based billing. For practice managers who have to consider the bottom line, I've worked the income generation as well. The total income for the session is over $900 with an hourly rate of $450 plus. This would definitely be worth considering if you're interested in adding allied health to your team, as the collaborative process is now being facilitated. We would also like to introduce you to our new community of practice for all things practice management and MBS in primary healthcare. This is a forum for like-minded practice managers and those that are interested in supporting general practice. Get to know your colleagues, share your thoughts, ask questions, brainstorm ideas. We know practice managers are key agents of change. They are leaders in the practice team and they're responsible for being proactive and taking that approach in care provision and business viability. Within the COP, or the community of practice, you will have access to the PHN developed resources, tools, updated information that will assist you with your practice to optimise your business and also your patient health outcomes. If you would like to be part of our community and join us, then please email either Heidi or myself, and we look forward to hearing from you. So, Jo?
Thank you, Donna. And for any allied health providers out there, I'm probably the key contact at the PHN. So if you'd like any further information or would like to reach out, then please contact myself. Thank you, Heidi and Donna. I'm going to pass to Jenny now to see if there's any questions that have come through. And we are hoping that some will come through. So if you haven't already done so, on the chat box, if you open it up on the drop-down box and put in any questions there, then that would be fantastic. Jenny, as I can't see them, are you able to let us know if any questions have come through?
Yes, Jo, we've had a few come through. Are these item numbers also available to nurse practitioners?
No. No, they aren't. Jen, sorry.
Okay. Does the allied health provider need to be employed by the practice?
No, the allied health doesn't need to be employed by the practice. It's for all allied health. They may have their own business model that they're following. They may be actually just using one of your rooms, so therefore they're in your practice and you work collaboratively with them already. But no, allied health is the focus for these item numbers.
Right. Does a specialist need to be in attendance?
No, I can answer that one, Jen. No, they don't, as long as there's still the 3 people involved in the care in attendance, so your GP and 2 other providers. And also as long as those other 2 providers are following the ruling around providing separate types of care.
Okay. How do we actually claim for allied health involvement?
So it depends on how you've got it set up. So if you're employing allied health, it depends on how you're normally billing, but you would be billing like directly under their provider number, obviously, and then you would just bill those item numbers that were listed, and same for the GP under his provider number. Is that answering?
I think so. Susan,
you have
who
anything
asked
to
that
add to that one,
question,
Donna?
if you wanted to add anything to that, just type it in. Can the allied health claim themselves?
Yep. Yes.
Absolutely, they can. If they've got their own provider numbers and they're running their own business, then their contribution is acknowledged under that business model and that provider number. So their autonomy is protected. It's just, in our example, we've had them as part of a practice team where they're actually employed by the practice as an example of what you could do and why allied health might be valued in the practice. But there's definitely supporting the allied health in all their businesses that they are already working.
Also too, Jen, just adding to that one, depending on their billing platform, they can direct bill straight through their Proda accounts as well.
Great. Does the patient need to be involved in every case conference?
Do you want to answer that one,
Heidi?
Donna?
No, I'm happy to. No, the patient doesn't actually need to be present. However, they are definitely need to be consulted about it and agree to the participation. And of course, if they want to be present, that's perfectly within their rights. And the same for their carers as well too. If the patient's wanting their carers to be part of the consultation as well, the case conferencing, that needs to be facilitated.
Okay. Do you need the patient's Medicare number for billing?
Anything that goes through the MBS, you will need a Medicare number. Yeah. So if the patient doesn't have Medicare, then they would be able to charge them privately. But other than that, yeah, they do need to have a Medicare number.
Okay, the questions are coming in thick and fast, which is fantastic. Are the item numbers available for EDP treatment plans or only GPMP?
The item numbers are tied to TCAs.
Yeah, sorry, I was trying to think ED. Yeah, I know what you mean. So that's the eating disorder. So no, they fall under a totally different category. They have their own different item numbers for care planning. So no.
Is there a template for the GP referring and consent for the meeting?
You want to get that one, Donna?
Not that I'm aware of, Heidi. Are you aware of any? My recommendation would be to add it as something that you would consider when you're doing your reviews and add it into your documentation, and also when you're creating your brand new TCAs. If you're wanting to introduce that model, it's a perfect opportunity to discuss it with the patient, make it part of the documentation. That documentation is shared with the other TCA participants. They're able to acknowledge it and make it part of their own records.
Can I just add, at this stage, Medicare has been pretty limited to what has been released around these item numbers. So at the moment, there's really only the fact sheet that's available. So hoping they might elaborate more once the explanatory notes get updated. But at the moment, the explanatory notes only link you straight back to the fact sheet. So once they release a little bit more detail, I have been liaising with Medicare around if they can be a bit more specific around what the eligible disability is. But at this stage, we're still waiting to get confirmation on that as well.
This lady just missed the start and she said, are these patients already ones that are on a care plan? Yes. Yep. Is it eligible for chronic disease management referrals or just TCA?
The item number information ties very, very clearly to the TCA review, which is really interesting descriptor. So that's as much information as we've got. As Heidi said, we're waiting for more details. MBS are not necessarily forthcoming with those at this stage, but it is very, very clearly about review process. So I guess you could look at it as a way to actually ensure that you actually are picking up on those review processes for your care plans and TCAs and making this a value add.
Are these item numbers counted as one of the 5 CDM claims for allied health?
No, totally separate. Totally separate.
Someone just said, what is a TCA?
Team care arrangement. The item number is a 723. All the details
That's
about it. It's a
billing item number.
and it sits beside a GP management plan, which is a 721.
Which that all makes up your care plan.
And it's part of the suite of item numbers for chronic disease management that GPs have access to.
How is eligibility for ASD/developmental disorder case conference determined?
That's what we're still trying to clarify with Medicare. We were hoping we would have had that answered by today, but unfortunately it didn't happen.
Okay, so Rachel asked that question. I would just maybe send Heidi an email, in about a month, Heidi, do you think?
Yeah, it depends with how long it takes Medicare to get back to me. But I'm happy to, if anyone wants to send me an email, I'm happy to forward you on the response I get from Medicare.
And this is probably another bit of a segue into our community of practice. So that's a great group to join, and you'll get all these answers, and you can ask the girls anytime any of these queries. There's just one more, just confirming only TCA at this stage and CDMs are awaiting confirmation.
No, the process has been tied to the team care arrangement review process.
Yes.
And that's how it's described. It's like you've really got to look at the detail of the descriptor with the MBS item numbers. It doesn't actually even mention a GPMP in place or a GP management plan, but that is part of what you are doing on behalf of chronic disease patients. So one doesn't get created necessarily without the other. So when you're looking at that, you're actually focusing on the review process once those are created, and that's where the opportunity comes for the case conferencing.
Okay. All right. Well, that's all the questions that we have. Did you girls want to say anything else?
I just a thought, Jo, did you want to flag what you've got upcoming or planning for the allied health as far as education?
We do have some more education plans specifically for allied health, and details of that will be coming out. Everything's going to be posted on the PHN's education events web page. But if you're not already linked into communications, please reach out to myself, and I can add you to some distribution lists. And we will, Jenny, you can probably speak to this about posting all of this information online.
Yes, so it will be on our webpage under our events calendar. We do also email all our distribution lists of upcoming events for allied health. So if you haven't been receiving emails from us, please reach out to Jo or the education team. Details are on our webpage, and we'll make sure that we get you on those lists so you're not missing out on any information. All right, well, thank you so much, girls. And don't forget to fill out the evaluation before we go. I just want to check one more thing. Someone's put their hand up. Oh, yes, I think we've received all those questions. Okay, thank you so much.
Thanks, Jenny. Thanks, girls.
Thanks.
Bye.
Bye.